Are you curious to see what happens to your Invisalign scan after you come in for your initial appointment? If you are, stay tuned and I'll walk you through what we do on our back end to make sure that we fully customize your treatment. And then also I'll go through a couple of key points of why it is so important to make sure you know who exactly is doing your Invisalign treatment for you. All right, here we go. Here is an example of a treatment that we're doing, and this wonderful young lady has allowed me to kind of use her treatment as a example. So what it is we get a bunch of notes back and forth with the technicians, and then this is the interface in which we use to try to communicate back and forth with the technicians. And then I usually always have our notes and our treatment goals and objectives, and also all of the records that that we're going to have for the patients and their treatment goal. This plan is to be set up for a surgical orthodontic case. So in the middle of the orthodontic treatment, we're planning a surgical simulation as well. And so what we do is we go through and look at our notes that we did. This is the second rendition back that we have had. And so then I'll go through and make any adjustments, just removing some of the spaces that was created by this movement. And then we're going to need to have some elastics to be worn. In Invisalign, you can do elastics a couple different ways. Just depends on the movement that you're needing. These are all the different attachments. Some of them are computer generated and some of them we place ourselves. And these are a little aligner enhancement that they will sometimes put on, and depending on the movements that we need, we sometimes override what the artificial intelligence tries to put on or what the technician puts in. And then there's a lot of aligner lag that happens, and so depending on the movement and what we're trying to do, the last stages are usually not straight. More the art of kind of what we're doing goes into place. And this is where I am looking into seeing how much the surgical jump is planned. The canine, it's around 4 millimeters and about 3 millimeters at the incisor. There's also a size discrepancy between her upper front teeth and her lower arch. We can then accordingly adjust the size and anatomy of the teeth to make sure that everything fits together just perfect afterwards. And so then our last step is for us to look at actually how the teeth move in concert with all the other teeth. And this is where the technician with this plan has made a couple of errors. We'll go through and kind of type in what's needed. So I am making sure that the both arches are being treated in concert, and that I'm also controlling when we're going to do the reshaping, exactly where we want to be after surgery. And then we'll just have some slight tidying up and closing up these upper spaces. And then at that point in time, it usually takes them about 24 hours or so to get back with us. So it's a pretty quick process. Sometimes it's a little bit shorter, sometimes a little bit longer. It really depends on their patient load and the number of aligners that they are producing at the time. But that's about it. Thank y'all so much. As you can see in that quick demonstration, there's a lot of customization that goes into our planning and staging and all the movements that we build into. We actually look at every tooth specifically and really try to customize its final position in harmony with the arch and everything else that we're trying to achieve for the patient. Clear aligner therapy has improved drastically over the last 20 years, especially in the last 5 years. The technology has grown tremendously. And the AI that's helped planning a lot of the treatments has also improved, but it's still not near adequate to plan the tooth movements in a human that's growing, changing, and the biology that goes along with it. So as you can see, just accepting a plan that is developed by the AI and the technicians, while it's a good starting place, that you really need to make sure that you find an expert who is really comfortable moving teeth with plastic, and has the experience and expertise to make sure that you can still get the same outcome that you're wanting to receive, no matter if it's with braces or any of the clear aligner systems. If you ever have any questions, please give us a call. We'd be more than happy to talk with you about different aligner systems and Invisalign and how it can help improve your health and your smile. Thank you so much.